More than 24 million Americans suffer from peripheral neuropathy, and if you were told nothing can be done and to take your medication, meet our next two guests. ReMed Pain and Wellness doctors Derek Southers and Fred Foster help patients reverse the disease with no medicine, injections, or surgery. Good morning.
Good morning.
Nice to have you
Good
here
morning.
with us this morning. First of all, Dr. Southers, can you explain for folks what is peripheral neuropathy and what are the common signs and symptoms?
Yes, ma'am. Peripheral neuropathy is basically a disorder of the peripheral nerves. Now, these are the nerves that run down our legs to our feet and our arms to our hands. Pardon me. It can be caused by a number of things, but the symptoms are usually numbness, burning, pins and needles, a loss of balance, because that's important to us. But these
really
are
uncomfortable things.
Yes, ma'am. Very uncomfortable.
Okay,
Very
and you
uncomfortable.
said there are a variety of causes?
Yes, ma'am. Yes, ma'am. Things like type 1, type 2 diabetes, chemotherapy, and autoimmune disease, and really something that's very insignificant but has a big impact is poor blood circulation.
Huh. Okay. So, Dr. Foster, poor circulation is a common issue with peripheral neuropathy patients?
Yes. The majority of our patients actually come in, they either have a previous diagnosis of a circulation issue or they believe they have a circulation issue. The non-invasive testing that we do allows us to determine if that's true, and also allows us to determine which modalities would be best to use to decrease the patient's symptoms and reverse their nerve damage.
Okay, we talked a little bit about it, but can you talk a little bit more about the different kinds of nerve damage associated with peripheral neuropathy?
I'll take that.
Yep.
There are a number of different classifications for nerve damage. Some of the simple and easy to understand ones are large fiber nerves. When large fiber nerves are not functioning properly, we don't sense perception and pressure very well, so we lose our balance. Small fiber nerves, they basically determine pain, stinging sensations. Small fiber, these are the ones that cause a lot of people to go, my feet are hot all the time, but they're actually cold, or vice versa.
Right.
So when one or even all of these nerves are not functioning properly, it causes a lot of confusion to the body and especially to the brain.
That's really interesting. So, Dr. Foster, after you determine why the patient suffers and the nerve damage type, how does ReMed Pain and Wellness reverse that damage?
Well, we use a variety of FDA-approved non-medical treatments. One of the devices that we use is a stimulation device that actually re-educates the nerve so it fires properly. This treatment is actually used by the Cancer Treatment Centers of America to treat chemotherapy-induced neuropathy, so we have a lot of success with it.
Yes,
Are there other treatments for?
Yes, there are. As a matter of fact, low-level light therapy is something that we use quite a bit. Now, low-level light therapy, all these are FDA approved. They're non-medical approaches, but they're extremely effective. Low-level light therapy can reverse the nerve damage by increasing circulation, by improving balance, speeding up wound healing. And something we find here quite a bit lately is people have restless leg syndrome.
Yes.
Yes, ma'am. They are usually suffering from poor circulation, and it also, of course, treats diabetic nerve pain and all forms of peripheral neuropathy as well.
Okay, and you have a special
Yes,
for
ma'am.
GMT viewers
Yes, ma'am.
to help you get started if you think that you may have this problem with peripheral neuropathy, to help you get started reversing the problem.
Yes, ma'am. What we do is we have these seminars which are made to help people understand what their options are. As you said in the very beginning, you're told to take medications.
Right.
The seminars basically give them a deep explanation of our treatments. Now, what we're doing is for the first 25 callers, there is a free, no obligation seminar admission. And they also qualify for a $49 consultation fee. Now, last time we were on here, we had over 200 phone calls. So I want to tell the people out there, if you can't get through, one of our answering team members will take the message and our patient care coordinator, Jeannie, will call them back, but we will get everybody in. You have my word.
Thank you so much. Thank you for being there to help people who have this problem.
Yes,
we know it's an
ma'am.
uncomfortable thing. Thank you for being on today. ReMed Pain and Wellness Clinic is on Beltline Road in Dallas. You can call 214-221-2588 or go to remedwellness.com for more information.